Dr. Rob Kuntz with Conley & Kuntz Equine Hospital, and today we're going to talk about diagnostic imaging as it applies to the athletic horse. And the first thing we have to do is define diagnostic imaging. Diagnostic imaging is exactly what it says. It's images or pictures that we take using different equipment to help us diagnose a problem. But it is also important to understand what diagnostic imaging can do and what diagnostic imaging cannot do. So lameness is a three-step process. Step one is figuring out where the horse is lame. Step two is figuring out why the horse is lame. And step three is treating the lameness. Diagnostic imaging comes into step two, figuring out why the horse is lame. But we can't skip step one. Many owners walk into our hospital and want to skip step one. They say, "Doctor, I want to take an x-ray of his ankle to see if he's lame there." X-rays, ultrasounds are not lameness meters. So we can take an x-ray of that ankle, and if we don't find anything, it doesn't mean that he's not lame in that ankle. Or if we do find something, it doesn't mean that he is lame in that ankle. So we got to go back to step one and figure out exactly where this horse is lame. And that involves doing a physical exam. It involves manipulation tests. It involves diagnostic nerve blocks. But we have to isolate where the lameness is coming from. So let's say that we isolate the lameness to his ankle. Now we move on to step two, which is figuring out what is causing the lameness. And this is a very important step. And that's when we use diagnostic imaging. So we might use x-ray to image bones or joints. Or we might use ultrasound to image tendons or ligaments or muscle. But we need to figure out what's causing the lameness. And that's where we use diagnostic imaging. Unfortunately, some veterinarians and some owners want to jump right to step three, which is treatment. And so when you go to a veterinarian that says, "Well, we're not going to do step one, we're not going to do step two, we're going to move right to step three, and we're just going to inject joints." And that veterinarian, every horse that walks in, injects the knees and the ankles and the hocks and the stifles on every single horse. They're skipping step one, figuring out where they're lame. They're skipping step two, figuring out what's causing lameness. They're jumping straight to step three, to treatment. And what they're hoping is that if they inject enough joints, that they'll hit the right spot, and that it will be the appropriate treatment. But the problem is, oftentimes they are not hitting the right spot, or that is not the appropriate treatment. So we got to stick with our steps, figuring out where they're lame, using diagnostic imaging or other modalities to figure out why they're lame. Then we can move to step three, which is appropriate treatment for that particular horse. A colleague of mine, Ken Allen, said that in lieu of a diagnosis, surgery is torture, medicine is poison, and alternative medicine is witchcraft. So we need a diagnosis. So if your horse is lame or not performing well, then call us at Conley & Kuntz Equine Hospital, and we can follow our steps. We can figure out where they're lame or why they're not performing well, what's causing the lameness, and then proceed to treatment, which has the best chance of getting your horse back to becoming an equine athlete. So give us a call at 877-499-9909 if your athlete isn't performing at his best.